Hello, everybody. My name is Michael King, and I am very, very happy to be spending some time with you here today. And I also am joined by a very special guest, Dr. Mark Schneider. How are you today?
Good, I'm doing well. Thanks, Michael. Thank you all for taking the time to attend the seminar. I hope that you learned some valuable points from it.
Awesome. And so, just to set the frame for everybody, we're here to serve you. We're here to answer any and all questions you have about this life-changing procedure. And as a way for us to show our gratitude for you attending, every one of you will save $1,000 off of your procedure here at the Tri-County Eye Institute. And also, for those of you, if after the webinar, you've decided that you'd like to find out if you're a candidate, if you stay to the end, there's actually an additional sort of bonus that we're going to give to you. So I'll go through that in a little bit. But the first thing is I just kind of want to do a little bit of housekeeping and make sure that you can all hear me properly and that you can actually see my screen, which says "Is LASIK right for me?" So, and that'll give you just a quick opportunity to see. On the right-hand side there should be a little panel that has a part where there's questions. And so that's the part I'd really like to encourage you to ask any and all questions that you have for Dr. Schneider, because at the end of the day, there typically has been maybe one or two questions that have held you back. So if you're able to hear me properly, just kind of write in the little questions part there or in the chat function that you can hear me okay. And then on top of that is if you have any questions that you want to kind of let us know right off the hop, I'll make sure I moderate those with Dr. Schneider. So, and somebody's already gone in. Awesome. Thanks, Lori. Appreciate that. So, excellent. So, one last thing that I do want to mention before we kind of get rolling is that your outcome for this webinar is not necessarily to say, okay, I'm ready to go forward and do LASIK. Really, it's do you want to find out if you're a candidate? Because a lot of people, they spend so much time kind of working themselves up and getting to the point of like, okay, I'm ready to do LASIK, and then they find out they can't do it because for whatever reason with their vision. Majority of people are a candidate, but that's really the number one focus of ours is, can you find out if you are a candidate for this procedure? It's absolutely complimentary at our practice, and that will be our invitation that will extend to you at the end of the webinar. So with that being said, want to just launch right in and say, well, why are you here? Like, what is it that's caused you to consider laser vision correction? And for most people, it's the obvious one, which is the freedom from having to wear their glasses and contact lenses. And some people who are highly active and just maybe it's they want to have a better golf shot, although we can't help you with that. But you want to be able to see things in sports or when you're exercising or wake up and hold your kids without having to grab your glasses or contacts. Like, there's a lot of different lifestyle improvements and just the time savings of not having to go back in and constant getting new prescriptions of glasses and contacts, and we'll talk a little bit about the cost savings a little bit further on down the webinar. So, Dr. Schneider, just with all of the patients that we treat, is there anything else in addition to this that you find what causes people to consider laser vision correction?
Well, a lot of people are just frustrated with their contact lenses. That's one of the biggest reasons people come in. They can't tolerate them, they get dry, their eyes get red, or they're afraid of some kind of emergency in the middle of the night where they just can't see and they have to struggle to find their glasses to get out of bed.
Yeah, it's rarely is it a sudden decision that somebody has. It usually takes a little bit of time, and one of the best places that I recommend that if you are interested in learning about other people's experiences is always just to go on to online, whether it be Facebook or Google or Yelp, and just to read some of the experiences that other people have had. And so here's some very kind words that some former patients of ours have said about us. But I do encourage you to make sure you check us and any and any provider of a medical service. It's always good to have this at your fingertips. So again, kind of going back to your reasons and your journey, if you will, if obviously California doesn't rain a lot, but if you were to ever be traveling in summertime or not in the summertime, in the winter, and it's raining, you can kind of your glasses can get foggy and wet. In the summertime, well, if you don't have a prescription pair of sunglasses, then you find that your quality of your vision with those regular glasses is not as good. If you've ever had the issue where you unfortunately break them, you know that that can be quite inconvenient. And in addition to that, if you fall asleep and you have them on, and all these are just some of the reasons that causes somebody to just be, all right, I'm frustrated, I'm ready to kind of consider something different. And so contact lenses on the other side can be a little bit of a hassle, and we've got some interesting sort of new studies that have come out talking about the safety of contact lenses, which we'll talk about in a moment. And the other side, which Dr. Schneider mentioned, is that your eyes can get really dry. And so sometimes a person who's wearing contacts, after a little while, just starts to realize it doesn't quite get them they're just not as comfortable anymore. Dr. Schneider, would you like to add to that about any of the things that you've heard from patients about kind of what's caused them to decide to go forward and have this procedure?
Well, like I said earlier, the contact lenses is probably the big reason, and particularly in this area, dryness is a huge concern. And we've found that the contact lenses over a long period of time will actually damage the oil glands that help produce part of the tear film, which could be one of the main reasons why the contacts become less tolerant. But again, the area here is so dry that it's just probably every single patient we see has some degree of dryness.
Absolutely.
And by getting rid of the contact lenses, it makes the eyes feel new again.
Excellent. And so I just want to preemptively let everybody know that we're going to be coming up to the main part, which is the Q&A portion. So definitely, if you've got any specific question, we're going to kind of precede it. We've got our top 5 questions that patients have, but if you have any specific questions that you've always wanted to ask, or any fear that you have, or anything like that, we definitely want to make sure that we cover that for you today. And so here's where we like to spend the majority of the time in our webinar, is to talk about the top 5 questions that patients ask. And so, Dr. Schneider, I'll kind of tee you up at the first one, which is maybe we could talk a little bit about the procedure itself, but then move to talking about recovery time, and so how much time someone has to take out off of work for that. So what are your thoughts?
So when someone comes in for a procedure, we let them know that the procedure itself takes about 10 to 15 minutes to do, but they're in the office for about 40 minutes or so. And that's because what we do is when they come in, we give them some sedation by mouth, and we recheck some of their examination, and then we get them ready to come into the room. But the procedure time is very quick, 10, 15 minutes. And then we tell them to go home and take a nap for a couple hours, because when the numbing drops wear off, the eyes can kind of burn and water a little bit. And we give them enough sedation so it kind of gives them a nice nap. As far as the recovery time, it just really depends on what someone defines as recovery time. Most people the next day, they come back in seeing better than they've seen with glasses or contacts, 20/20 or better vision on day 1. Most people don't have to take time off work, although we do see a fair number of healthcare professionals, doctors and nurses, and if they're working in the hospital, we ask them to take a day or 2 off just because of the the bad bugs that are prevalent in the hospitals these days. But most people return to work the next day. They're able to use a computer, read, pretty much do most things.
Absolutely. And what about the question of, is this a permanent procedure? Is this something that someone has to have done continuously, or is this just what's your take on that?
No, LASIK is a permanent correction of the vision. Having said that, in our hands, about 1% of the time, we've been doing this for more than 20 years, and about 1% of the time we'll find that someone's eyes may change due to a variety of different reasons. One of the things that, though, I want to make very clear is that if you have this done when you're 20 years old, there's a huge benefit, because you get 20 plus years of unaided vision typically. Because what happens is when we tend to get in our 40s, something called dysfunctional lens syndrome, or presbyopia, starts to kick in, and that's where the close-up focus doesn't work very well. Now, we have other procedures that will address that nowadays. LASIK isn't the only thing that we do, but that's a normal age-changing process that occurs in everybody.
Excellent.
But as far as the distance correction, it's typically a permanent correction.
And so Lori asked the question is essentially just the reading question. So can they do LASIK for reading? And she says she has 20/20 vision when seeing far away, but can't see sort of anything up close. So that's a great question, Lori. Thank you so much. What are your thoughts about that, Dr. Schneider? And
So
what
we do
options do you
several
have?
things. So we try to customize the treatment based on your needs. So we have a variety of options for that. We can do something called blended vision, where we take the non-dominant eye and give it the ability to see up close. Depending on someone's age, we can also put in a multifocal implant inside the eye, which is like putting a progressive lens inside the eye without all the problems of progressive eyeglasses.
Mm-hmm.
There's some newer things called corneal inlays, and that sometimes can help the reading vision. But we have a lot of options to help people that are having difficulty with reading glasses.
Absolutely. And the when it comes to LASIK versus PRK, how do you describe them to a patient? The difference between the procedures.
So when we first started doing laser refractive procedures, PRK was the only thing available. Mm-hmm. And PRK works on the surface of the cornea. And we'll still sometimes use PRK, maybe 10% of the time, but mainly reserve it for people whose corneas are too thin, or they may have some scarring on the surface of the cornea that we can remove at the same time. So we kind of kill two birds with one stone, so to speak. That the difference is basically in the healing time. With the PRK, we remove the surface of the cornea and then reshape the middle layer, and then we allow the surface to grow back in. The eye is one of the fastest healing organs in the body, but it still takes between 3 and 5 days for that surface to grow back. So the vision's a little blurry and the eye's a little uncomfortable during that time. Versus LASIK, with LASIK we create a flap of the cornea using a laser, which acts like a human Band-Aid. And that allows for really rapid recovery. I mean, that flap seals down in about 2 hours, and that's why when people wake up from their nap after LASIK, they're comfortable, they're already seeing, they're able to watch TV that evening. So the LASIK and PRK both offer very good results. It's mainly the healing time that the difference is.
Excellent. And number 4, which is what does it cost, I'll be going through a little bit later on pricing. Let's talk about safety. So how safe is this procedure, and what are some of the things, whether it be through the eye trackers or just all the different diagnostic and testing that we have in place? But if somebody has that question about safety, Dr. Schneider, what are the things that we have in place to address that?
So that's a really common question, or a really common concern: is it safe? And we just finished participating in a multi-clinic trial across the United States comparing the safety of contact lenses versus LASIK. And we found that LASIK is far safer than contact lenses. That's something that nobody talks about. But as far as the safety of the LASIK procedure itself, there are several things that we do to ensure your safety. Number 1 is that the laser is calibrated between every patient before we proceed with surgery. Number 2, there's a eye tracking device. So once you lay down and look at the fixation, which is like a little blinking red light, if you even happen to move your eye a little bit, the laser will track it. So people are always concerned, well, what if I blink, or what if I move? Well, that isn't really a concern because the laser can track that. As far as the procedure itself, if the machine, when we're doing the calibration or the checking of the machine, if everything isn't absolutely 100% perfect, the machine won't let us proceed, which is kind of a blessing and a curse combined. Because what happens is, if we, for some reason, the laser's not firing right, well, surgery's canceled that day. We need to reschedule and have you come back. We all know that these things are very high tech and computer driven. Just like your computer, sometimes they aren't working, but it never happens during a procedure. That can't happen.
Got it. Here's a great question here from Diana. I'm not sure how well we'll be able to answer, but I wanted to make sure that I addressed it. So she says, I had LASIK done 15 to 18 years ago. I'm a 70-year-old female. Within the last 2 years, I've had to use prescription glasses for reading, especially when it's darker. The procedure was done in my right eye for computer work, and then she also says, I had worn a contact in my right eye for computer or close work for about 10 years, no problem. My left eye is great for distance. I think the short answer for us would be we'd love to have her come in and examine her eyes and see where things are at, to be able to give her a complete sort of answer, but anything initially you'd like to say, Dr. Schneider?
Well, I mean, the thing that comes to mind immediately is that, typically, as we addressed earlier, that lens inside the eye continues to change each year as we get older.
Yes.
And it could be a number of things. It could be a lens opacity, which is a form of an early cataract, or there can be a problem in the retina that's preventing that reading problem. So yeah, really the best thing would be to have the eyes looked at and see what can be done, because if it is just a cataract, then we can easily, give that vision back for the computer again by putting in a multifocal lens, or we can even do blended vision with an implant as well.
Yeah, and again, that's one of the biggest reasons why back to the front part of the webinar, where every one of you are going to have a very unique situation or challenge going on with your vision, and the best way that we can really help to understand what's the right course of action for you, and that's one of the greatest benefits that we have at Tri-County, is that we have a lot of different solutions for your unique visual challenge. And so that initial consult and examination, Diana, would be a great one for you. So if there's any additional questions, so please, I do definitely want to encourage you to ask them. I'll be moderating them. I'll kind of ask them as we continue on with the webinar. But again, any and all questions are fair game. So Dr. Schneider, to your point earlier, you mentioned about the safety of LASIK versus contact lenses, and here's one that's done by the Oregon Health and Science University. Just as much as we'd like to think people's hands are nice and clean when they're putting their contact lenses in and out, sometimes they aren't, and that over a period of time can kind of cause some bacterial infections. Is there anything else in addition to this that's on the slides here, Dr. Schneider, you'd like to add?
Well, just adding to the contact lens, I know people who wear contact lenses all fall asleep in them occasionally, or there's some people who see doctors that allow them to sleep in the contact lenses, which I never think is a good idea. What happens is when the cornea gets less oxygen during sleep, you get microscopic scratches on the surface of the cornea, and that's where the bacteria that live on our face can get underneath the contact lens and cause these serious infections. So yeah, the contact lenses are not a good long-term idea. Excellent.
And just here's some additional items here. Just talking about the health risk of contact lenses. It's one of those things that's a little bit counterintuitive, but if you think about it over the course of your lifetime, LASIK is an incredibly safe procedure. It's contact lenses, that constant finger in your eye and kind of taking that lens in and out, and it just starts to add up, if you will, over time. And so usually for somebody, it's generally that their eyes just get too dry to wear contacts, which is one of the reasons why people consider LASIK. And so I do want to cover pricing. And so what I've done is we have taken, as I mentioned on the front part of the webinar, you'll get a $1,000 savings at our practice. And when it comes to this actual procedure, if you think about it over the course of your lifetime, the amount that you are spending on glasses and contact lenses, it really starts to add up over your life. And so the nationwide average for LASIK, we're right on the average. This is price here with $4,400 is with the $1,000 off. And so we have some exceptional financing packages through Wells Fargo or through another company called Alpheon, and kind of spreading this out over a couple of years. And so that's that's what I find that patients, they start to look at it and like, okay, this to me is something that I want to be able to now live a life without having to wear glasses and contacts, because you're really end up spending a lot of money throughout your life. So knowing which exact, what's the right procedure for you, we really find that out at your initial consultation. And as I mentioned, that's absolutely complimentary. And another slide I wanted to talk about is just about here from the FDA, and they're talking about just the safety of LASIK and just the results. LASIK is outstanding when it comes to the visual outcomes that people can get, and most people are driving and within 24 hours, if you have LASIK and you're back to work within a day or so, it's a very, very quick recovery. And so and here's a slide here that I wanted to kind of lead in with, which is just how are we different. And so again, you can kind of read them on the page here, but for the most part, I like to believe that we really, really are passionate about your vision and your just your eyes and everything that we can do. Just we're really grateful for the opportunity to help the patients out that we have. And so, Dr. Schneider, is there, if you're a patient kind of considering our practice, and what would you say is kind of just from your own standpoint, like why somebody should consider choosing us?
Well, I think, it's kind of my lifelong passion to correct people's vision.
Mm-hmm.
And I think we have a team that feels the same way, and I think that you'll feel it as soon as you walk in the door, that we really care about your outcomes. We're not like a cookie cutter kind of mill type place. We take each person individually, and we really customize the treatment to your needs. And I think that's one of the things that you'll find, that why are they asking me all these questions about what I do, and like what do I like to do in my spare time? And the reason we're asking all these things is because we truly customize the procedure to how you want to see. That's what makes us a little bit atypical, because we don't just do one procedure to correct your vision. We have 8 different procedures that we do, and we'll pick the procedure that's right for you, and that's right for you forever. So, I always tell people, if you go to a Honda dealership to buy a car, you're going to buy a Honda. You're not going to buy a Mercedes. So if you go to a place that only does one thing, you're going to get that. And so one of the advantages of coming to a place where we do all of the treatments is that you'll get the procedure that's best for you.
Absolutely. And so here is one of my favorite slides, which is where we get to kind of talk all nice things about you, Dr. Schneider. But I'd love to, if you don't mind, just share your story. Like what, you made the decision to, to study many years to become an ophthalmologist and to specialize in this one type of procedure amongst many. What was it like? What kind of caused you to kind of go down that path and devote your life to people's vision like this?
Well, I mean, it's just really fun. I tell people I have the best job in the world. I mean, I get to change people's lives in, half an hour. The next day they come in, they're excited and ecstatic, and I feel very blessed to be able to be part of their journey to get rid of their glasses and their dependency on contacts. It's really fun. It's positive. We help a lot of people. It's a great thing to wake up every morning knowing what I get to do.
Awesome. And again, it's we're kind of we like to keep the webinar to around half an hour. We're a little bit under right now, and so I wanted to really make sure that if there's any additional questions, we got a few more slides here, but if there's any additional questions that you do have that maybe we haven't answered, I'd like to kind of give you that opportunity now to ask them. One that we do get that's common revolves around night vision, Dr. Schneider. So could we talk just a little bit about how today's technology is able to address and not the whole glare and halo kind of conversation post LASIK? What's your take on that, and how do you respond to that if a patient asks you?
Well, in the past, the technology was a little bit different than it is now, and some patients did have some issues with glare and halos at night. But now with our advanced technology and a little bit more understanding of those patients that did have a little bit of glare and halos, we're now able to prevent it in most people. It's really a very rare problem. Actually, nobody really complains about it. Now, having said that, one of the problems, I mean, early on in the first week or two, most people do get some halos and glare at night, and that just has to do with the healing process and a little bit of swelling that occurs at the time of the procedure, but that typically goes away in a couple of weeks. But today's technology can address little microscopic changes in the cornea that we could never do before, so it's really not much of an issue.
Excellent. And so we have a couple questions here. One's from Kimberly, and it's, hi, if a multifocal lens is used and the reading portion of the eye worsens, do the lenses need to be replaced as we age? So that's obviously different than LASIK, but for those people that are kind of that age where reading vision is an issue and they do go down that path of having the lens, what's your answer to that question?
So that's a great question. I mean, the multifocal lens that we place in the eye after removing the dysfunctional lens, it's made of acrylic and it never changes. It doesn't go bad. It doesn't age. So it's not like the normal human lens that over time gets weaker. It's a permanent fix. It never needs to be changed, never needs to be replaced. I've done more than 10,000 lens implant surgeries, and we've never had to change a lens once.
Excellent. And Garrett, I apologize, Garrett, asked the question, and I'll tackle this with Dr. Schneider, which is, would my insurance plan, like Vision Care or Blue Shield, cover any of the cost or, for this procedure? Sometimes you'll find that insurance does cover some. I don't think that Medicare does, which is the other one that you mentioned, but what we typically recommend is that, when it comes to your insurance, they're all so different. If you need any assistance, obviously when you come in for your examination, we could talk a little bit more about it. But what I found is that some employers will actually be able to cover it, some don't. I always recommend to check in with your benefits manager or your HR manager, and they'll be able to really set you straight. Again, if you need any help at the initial consult, we can kind of talk to you a bit more about that. But I wish that I could say to you that a lot of the insurance companies pay for it. They don't. It's typically a percentage, sometimes 10 to 15%, sometimes that they cover it. So here's a question for you, Dr. Schneider, from Brittany, which is, what about the fear of things coming towards your eyes? I could never do contact lenses. That's a really good question, Brittany. So what's your thoughts on that, Dr. Schneider?
So we have a lot of patients that are concerned about that, but couple things. First, we give you some sedation that kind of takes the edge off and puts you in a mellow state. And then secondly, you really don't see things coming at you, because what happens is once you're under the microscope and you're looking up into the microscope light, it kind of bleaches out the retinal cells, so you just kind of see vague shadows. You really don't see anything that's going on. So it's really a lot easier than you think.
Excellent. And Stephanie asked this question: if a retreatment or an enhancement is necessary, what is that included in the package that they get at our practice?
Yes, it is. What we find, the one thing that we can't control 100% is the way an individual heals. And in about 1% of cases here, someone will either heal too fast or heal too slow. And then at about 2 to 3 months out, we may have to make a little adjustment. And yes, that's 100% covered.
Excellent. Really good questions, everybody. So again, I've got a couple more slides, but I do want to say if you've got any additional questions, just let us know, and we'll kind of go through those. And so here is the opportunity for you. So if after this time spent with us that you would like to find out if you're a candidate, a benefit of you being here is you get a little additional sort of bonus, and here's what it is. So again, every one of you that is here on the webinar will save $1,000 at our practice off of your LASIK procedure. But if you are somebody who wants to find out if you're a candidate, between now and Friday, if you just give us a phone call or schedule your appointment online, you'll get an additional $200 savings. Now, that does not mean you have to have your consult in the next couple of days. It just means you have to schedule it. So it's just our way of thanking you for attending and giving you just that extra little supportive nudge to take action. Again, the consultation is 100% complimentary, and we take a very relaxed, organic approach, and we don't kind of give you any pressure. But that's there for you. So all again you have to do is just give us a call at the number that you see on the screen, or you can just go to our website. We have a nice little online scheduler that allows you to do that, and that'll give you that additional $200 in savings for your procedure. So with no further ado, this is the final sort of slide. Again, I'll just give another 30 seconds here for anybody who has any questions, and if not, then that's fine too. But Dr. Schneider, is there any final thoughts that you'd like to add, or if you had somebody who says you just want to give them that last little sort of statement about this procedure, what would you say?
Well, first I want to thank them for attending the webinar. I hope you gained some valuable information from it. But, a couple things that patients always say, this is like almost every single time, is number one, I can't believe I waited so long. Mm-hmm. Number two, it was the easiest thing I've ever done. And there's actually a third thing, and thank you for changing my life.
Yeah. Yeah, it really is a blessing what we get to do. And again, I know that everyone's time is precious, so I want to be very respectful of your time, and again, really give you a heartfelt thank you for spending some time with us here today. If you have any additional questions that that weren't answered, have no fear. Just give us a call, and we'll be able to answer them for you. But on behalf of Dr. Schneider and all of our staff, just really thank you so much for attending, and we look forward to seeing you when you come in for your consult. So. I guess last one. Oh, thanks, Garrett. Garrett says, thank you. This is a great presentation. Really appreciate that. So, Dr. Schneider, that's it. Just any final word?
Nope, just thanks again.
All right, everybody. Have a wonderful rest of your day, and we look forward to seeing you when you come in. Take care, everybody. Bye-bye.